As you know, the whole world is experiencing this pandemic from this beta coronavirus known as SARS-CoV-2 or severe acute respiratory syndrome coronavirus 2, and the infection is referred to as COVID-19. It was initially discovered in Wuhan, China, end of December, and very quickly this escalated into a global health crisis, as we know. And I think as of yesterday, these numbers keep on changing, but I think the number of cases have exceeded 1 million. And then I think in the United States, it was more than 250,000 the last time I checked, with close to 6,000 deaths. And some estimates that, the peak of this pandemic in the US would be in about 2 weeks. So we are still expecting a lot of fatalities from this pandemic. And I think the current estimates put the number of deaths to anywhere from 100,000 to 200,000 in the US alone. And under these circumstances, as you know, patients with cancer who I see every day and care for, are especially vulnerable to this COVID-19, as cancer patients are in general older, have a lot of comorbidities, and are also immunosuppressed from this cancer and its therapy. And of course, from this COVID-19, there's a disruption of routine clinical care and participation in possible clinical trials. And when we looked at the literature in cancer patients, there's actually limited data on this. If no one has in detail studied the impact of this pandemic on care of patients with cancer. I think there are a couple of studies which just shows that patients who have a diagnosis of cancer had higher risk for several complications and death from COVID-19. Therefore, we wanted to study systematically how this pandemic is negatively impacting cancer-related outcomes, both at an individual level and also at a society level, both looking at the short-term impacts and the longer-term impacts. So what we were aiming to look at the studies, initially this effort started as a registry study, a retrospective study, looking at cancer patients with COVID-19 at our Masonic Cancer Center in Minneapolis, Minnesota. Dr. Heather Nelson, Dr. Holton, Ann Blaze are the co-investigators of this study. And I have to really thank the Vice President of Research, Chris Kramer, and our Dean, Jacob Toller, for funding this project through the COVID-19 Rapid Response Grant. And later, what we did was, as we were designing the study, we joined hands with COVID-19 Cancer Consortium, which is really remarkable that over a span of maybe 2 weeks, this was a multi-institutional consortium that actually started on Twitter of more than 50 cancer centers throughout the U.S. Who got together to address this common question as to how this pandemic is impacting cancer patients. So we can actually rapidly learn and disseminate information as we go along. The main PI of the study is Dr. Warner from Vanderbilt University, and I'm the PI at this site in Minneapolis. So the idea is to retrospectively identify patients with the diagnosis of cancer who tested positive for COVID-19, and to establish a large retrospective or prospective cohort database in these cancer patients in the context of COVID-19 pandemic. The goals of the study were to kind of describing the management and outcomes of these patients with cancer and COVID-19, and also try to look at, if there are any specific patterns of disruption of care of these patients, and also describing the impact of COVID-19 on the cancer clinical research and clinical trials. So the way we kind of designed the study is we kind of retrospectively identify patients who had a diagnosis of cancer and who were either tested for COVID-19 or had a high clinical suspicion. So we went to we are planning to going back to the medical records and extract several kind of important clinical information. And I like to divide them by looking at 3 different categories, just the demographics, looking at age, sex, smoking status, comorbidities, and medications. And then the second factor is COVID-19 related, what symptoms they had, what was the course of illness, was it mild, moderate, severe, how many of these required hospitalizations, how many ICU admissions, how many needed a mechanical ventilation, what complications did they have, like respiratory failure, if they had any clotting problems, bleeding problems, things like that, what lab abnormalities were present, and did they receive any specific treatment for COVID-19. And then the third kind of aspect is cancer related. So what type of cancer they had, what was the stage of cancer, were they on any active treatment, what the details of active treatment, was it chemotherapy, was it immunotherapy, what was the intent of treatment, was it in the adjuvant setting, neoadjuvant, so a lot of cancer related variables. And then finally, looking at outcomes of these patients, how many of them died in the hospital, how many of them were hospitalized, what was their condition or discharge. So all of this information is identified, and then we enter this into a REDCap survey-based database. What we are trying to see are looking at outcomes both in the short term and in the long term. And we want to basically come up with some basic statistics, in cancer patients. So what's the rate of COVID-19 positivity in these patients compared to the general population? How many of these are mild, moderate, or severe? Our hope is to identify any specific pattern in these patients, especially the ones who have severe or adverse outcomes. And our hope is to identify any vulnerable population, for instance, anyone who is at a high risk for adverse outcomes. Are there any specific group of patients, for instance, lung cancer patients or immunotherapy, are they at a higher risk for severe COVID-19 related complications? And then also we hope to identify with labs and based on clinical presentation, is there any way can we predict ahead of time early in the disease course as to which patients will develop severe disease. That way we can intervene early in the course and possibly change the outcomes, and also look at any specific complication that are specific to cancer patients. So these are kind of the short-term outcomes, and long-term outcomes, looking at how this COVID-19 affected the cancer outcomes in general, what were the outcomes of patients who were on clinical trials during this time. So these are the things we're looking at. I think, that's a good question. And, I think right now we have to kind of come together as a scientific community and doctors to kind of help curtail the spread of this COVID-19. It doesn't matter where you're from. I think everyone has to do their bit in contributing to stopping this pandemic. For instance, maintain social distancing, physical distancing, try to wear masks if you can, if you have accessible, make sure healthcare workers have PPEs, because they are the ones in the front line who are taking care of these patients. And so just do your bit. And I'm hopeful that in the next coming few weeks, we'll have results of, some of the drugs that are being tested in this space. And also, there are a few candidate vaccines that are in the early stages of testing. So hopefully this will be there with us for a while. This will be there for a few months. So we have to understand this is probably our new normal, and be prepared for difficult times in the coming months. But I'm hopeful that with all of these efforts, we'll be able to overcome this pandemic in the coming months.